So
Okay.
I just did surgery for him like 5 days back.
Okay.
We have a lot of patients who have come from Vijayawada and Visakhapatnam and yeah, tell me. Yes.
Actually, I want a sharp and straight nose.
You can do.
I'm thinking I'm having DNS, sir.
You have DNS also? I'll check that and tell you.
But not much.
I'll check that. But how do you know you have DNS? Is it because you're having any blocked nose or breathing problem?
Sir. Like by seeing the evidence.
Ah.
I'm just thinking I'm having DNS.
But we have taken your scan.
No, sir.
Not taken your
done.
scan.
I just can't.
So we should take. Because DNS is deviated nasal septum. That mostly we are able to see in the scan. Hello? Okay. Done. Thanks. There's a slight bend, but if it's totally deviated, I'll have to see. But we can give you a good result. We'll give you a nice tip,
Okay.
Reduce the width, pointy.
And next I want here the
Height.
skin should be like tight in here, sir.
That means you'd increase the height.
Okay.
Okay, then what else you want?
Next, could you make my lips like this? I'm just asking. Is that possible?
It's quite broad, your lips, right?
Yeah, I want short.
Very wide lip.
Is that possible?
How this? Smile now. Open your mouth. Bite. So it's not that it's not possible, but we might have to do some jaw surgery for that.
Okay.
It's a too big a procedure to get that kind of result. So just leave it. Not worth doing a very big procedure for Telugu. Hindi malum hai?
No. She knows only Telugu.
Okay, you can explain to her.
Yeah.
Because I don't know Telugu.
Okay.
It's a problem. I cannot understand a little bit.
For the nose
Nose will be
best
very
difference.
nice. We can give you a good result.
I want the skin to be like this here.
Yeah, that's I'm writing that point also. We need to take rib.
Okay. Without it, we can't get the straight nose.
Without, see, the main thing is your support here is very less. So first is we have to give support there.
Okay.
Then this area we need to give support. So everywhere we need.
And I want not this broad nose.
That is definite. That is the main thing.
Yeah.
That is number one. That is number one. So the procedure for you will be septorhinoplasty with rib harvest and also augmentation rhinoplasty.
What is the difference here?
No difference. It's just the exact type. Augmentation means you want some height here for augmenting with this thing. Septorhinoplasty means we're going to work on the
I'm
septum.
not having the DNS right, sir.
We have to see in the scan and confirm.
Okay.
If it is a DNS, I'm suspecting like what you're saying is DNS. That's why I'm saying septorhinoplasty. Otherwise, only rhinoplasty.
Okay. In the scan, you'll rule out.
That we can check the scan and tell you.
Yeah, how many days I should stay here, sir?
7 days at least, 8 days maybe after surgery.
So, why, sir? You said only 5 to 6 days.
When did I say 5 to 6 days?
I don't
Rib
know.
harvest means it will be 7 days minimum. So don't do. And if septal work is more, extra time again. See, the all septum is partly cartilaginous, partly bone. This is cartilaginous. Bone is bone. So when we work on the bone and cartilage, healing time is more. You go off to Vijayawada, some far off place, how I'll be doing follow up. Something goes wrong there means it's headache for you. Go to hospital, then they will take a scan, admit you, all headaches. If you stay here for long, then what happens? I do the review. Then after that, nothing will go wrong. So it's safer. Because see, all of these are not minor surgeries. It's all general anesthesia, 3 hours surgeries, rib harvest and everything. So we have found out that this system is working for a lot of patients. Normally what we do surgery, wait for 4-5 days, then do the next review. After that only we send the patients back.
For rib harvesting, it will take 8
Extra
days.
2-3 days you keep. You're not booked your tickets, right?
No.
Okay, so if we do the surgery tomorrow, maybe next week,
What are
one
the
day.
precautions I should take, sir, after surgery?
Here when you are there, we'll let you know. No
If
precautions.
I get like cough, cold. if
Nothing.
there
That all will put you on medicine. Nothing will get like that.
Okay. How many days will keep me on injections and
Injection maybe 4-5 days.
4 to 5 days? Sir. Okay. After that, you will change me to tabs.
Tablets, yeah. Then we can send you off the hotel also at that time
Okay.
if needed.
What are the medicines you will use, sir?
Nothing. Just antibiotics and painkillers.
Okay.
Nothing more.
5 days we should need.
We will need it. Correct.
Okay.
What field are you studying or working?
Actually, I completed my MBBS, sir.
MBBS.
Yeah.
You should tell your doctor, no?
I wrote, sir.
Where have you written?
No, sir, not here.
Ah.
I written my. They'll give me a slip, right? So
Ah.
I wrote there.
Because from your questions, I'm thinking maybe you're a doctor, that's why I'm asking. Okay, good. So if you're a medical doctor, it's safer. I might let you off a little earlier. You can go back and check and all that. See, doctors and all, because you know, and you know other friends, you can go, so I can let you off 1 or 2 days earlier. You can go after 7 days also maybe. So because you understand, you can take care of yourselves, that's all. Diet, no restriction, obviously. Pain,
The complete
minimal.
Healing, how many days it takes?
Months.
Usually? Months. How many months? Sir?
Complete healing might take 2-3 months.
Okay.
See, the third healing for rhinoplasty, whenever we are doing augmentation with rib and all of these things, to be very honest, some patients even tell me 6 months.
Okay.
Takes a long time. But nobody will know. But you will feel as if, something is heavy, like this, some feeling you will have. Discomfort, but not the normal feeling of how you feel your nose.
Okay.
For that, it might take even 6 months. But after 1 month or 3 weeks, nobody will know you've had any surgery.
Okay. After 3 weeks,
It'll be perfect.
everything will be covered up, sir. Like sutures and everything.
Sutures and all we'll do it on 7th day only.
Okay.
7th day. After no sutures. So you're studying for NEET, huh?
Yes.
Or you're given NEET already?
No, sir, I'm studying. I have given, but I'm getting ENT and off the anesthesia. But I want medicine
Oh, you want to get medicine?
or radio.
Oh, okay. Which is in most demand now in the PG section?
I think
For girls?
dermatology and radio.
Dermatology has become like that?
Yes, sir.
Why is the reason?
Because
Work is no emergency.
no emergency.
Gynecology and all?
It's stressful, sir.
Correct. Work is more, so less people. So you're interested in general medicine.
Yes, sir.
But then you have to do your super specialization, right?
Yes, sir.
Right.
So I'm thinking to take radio or general medicine in between.
All the best for that.
Okay, thank you.
Alright, so okay, so what we'll do today is then we'll take your scan first.
Upper lip is somewhat like it's protruding.
No, it's correct. It's just wide
Yeah.
a little bit, that's it. You're still beautiful, leave it like that, don't do much. Sometimes, we can change, but I'll have to bring your jaw forward, downward, and all of those things. And so your face is now a little bit round. If it becomes little longer, that will get corrected.
Okay.
But that's a big procedure.
Okay, sir.
I don't think you would need that.
Okay, after rhinoplasty, I'll think if I
No. Rhinoplasty, if you do, then you should not do that procedure because the nose might get disturbed because the upper jaw is in the nose.
We should take at a time everything, right?
Not like that. The jaw should be first if you want to do. I don't think you should do it at all. You're not a good candidate for that. See, I can do, but see, sometimes it's like this. The work is so major, but the result is not relative to that. So the benefit versus the thing is not so much.
Okay.
So why would you want to do? You're a doctor also. If you are thinking of doing some modeling, something like that, then I'll not say like that. But you want to do medicine,
Yeah.
don't do two hands.
Okay.
Because see, your skill is different.
Yeah.
Your skill is based on your knowledge and you're going to be treating patients. I know you've got to be making yourself as handsome or as beautiful as possible, but within limits. I mean, not do that extreme. Some other people, they are thinking from a younger age, they want to do modeling, acting, something like that. Then we can consider all these options. For them, it's worth the risk also. So,
Sir, how many days after I should go out, sir? Actually, how many days I should take rest, sir, in home? Here 1 week.
After that, over 1 week.
2 weeks. Total 20 days.
15 days, 20 days max.
Okay.
If you have to see patients, you can see patients after that.
Okay. I can go to beach or anywhere. What I like.
No. So you can't swim in the water.
Okay.
You can't do exercise. You have to be careful, such things.
For how many months?
At least 2 months, 1.5 months.
Okay.
Beach you can go sit, but not swim
Okay.
after 2 weeks. Water will go inside and it can cause problems.
How after how many months I can be normalized and now?
1 month,
1 month. I can be
3
normalized.
weeks.
Okay.
You might feel normal even before that. Some patients even 10 days they are normal. By the time they go, they're fine.
Okay.
Let us try and schedule. When would you want the surgery, doctor?
If you wish, today or today.
No,
or
today
tomorrow.
we're totally full. Tomorrow also we're a little bit busy. I think I'll find out. We'll try and give you some slot tomorrow.
Okay, sir.
We have like a lot of babies who've come today, and some patients didn't come in the earlier appointments. So yeah, so we'll do the process for you
Sir,
quickly.
if we do, my nose will become like long, sir.
Yes, it will become long a little bit
Okay.
by maybe 4-5 millimeters. Pointer, narrower, and he wants height also. So height also will go out. Height also
Then only
3-4
my
mm.
skin here becomes like this, sir.
Which one?
My skin here becomes like this now.
Yeah, it'll get raised. Once it gets raised, it will get tighter there in that area.
After doing that, any shape changes here?
The lip?
Uh,
Usually no, unless you want me to try and do something from this angle, I can do little bit maybe, but not major, not possible.
okay. It's not protrude, right?
No,
Okay.
nothing like that.
Like if you do like this, it's not protrusion I'm saying.
No, it will not happen, don't worry.
Okay.
Only if I tighten the muscles and bring it forward after I open the base, no such things will happen. We will not do that for you.
Okay, sir.
Won't help.
It will be same as now.
Yes,
Okay.
after heels will be same only.
Okay, sir.
Alright? See you then. Bye.
Thank you, sir.